All right, summer's here, but before you get that summer tan, you do need to be safe.
Too late now. I was born with it.
Need to be safe about getting your glow.
Dr. Tony Nakhla is the medical director of the renowned OC Skin Institute in Santa Ana. He's also the author of an upcoming book called The Skin Commandments, 10 Rules to Healthy, Beautiful Skin. Like me. Thanks for being here.
Thank you so much for having me.
I guess it's kind of that time of the year, isn't it, when we need to start thinking of this? Or, of course, in your business, you probably think about it all year long.
Exactly, especially in Southern California. It's really something that has to be at the forefront of your thought every time you're outside, basically. And my advice to patients is apply sunscreen every day as though your life depended on it, because it may. A lot of people who live in Southern California are fair-skinned and are at risk for skin cancer, some of the more deadly types of skin cancer as well.
So even if you're not doing outdoor activities, even if you're not going to the beach, going to the pool, going on a hike, you need sunscreen? You
need to cover the sun-exposed areas like the face, neck, and chest. And that does two things. It prevents sunscreen from occurring on the face. It also slows down the aging process. So, you know, if you want to really maintain your beauty, one of the top beauty tips is to apply sunscreen every day.
You know, one of the things I always think about is our ancestors, forefathers never wore sunscreen, and they spent their whole lives out there. I mean, we didn't have the modern homes we do today. What's happened over the years?
What's happened over the years is that two things have happened. First of all, you know, we've become accustomed to laying out in the sun and baking our skins in the sun. And also the tanning bed industry, which boasts over, you know, I don't know, I think a few $100 billion in sales, has emerged. And you know, these types of outdoor behaviors were never part of normal living. People who, you know, lay out for hours aren't really using their skin to protect themselves. They're using it as a sort of vain way of producing melanin pigment and darkening their skin.
And when we're using sunscreen, we have to use the right kind, the right amount, and we have to know how to apply it. There's all sorts of recommendations that you give.
Absolutely. The first most important tip is to choose a sunscreen that contains both UVA and UVB protection. Those are the two types of harmful sunlight. Most sunscreens only cover UVB. You got to choose one that covers both. The label should indicate on the bottom broad spectrum coverage, which indicates that the sunscreen protects you from the harmful types of sunlight.
And once I find that, how do I put it on? I figured you just slap it on, right?
That's a good question. Most people show up to the beach or pool and start slathering on sunscreen. You need to do it about an hour before, and you need to apply an adequate amount of sunscreen as well. For the face, you need about a teaspoon worth to adequately cover the face. For the body, believe it or not, you need about a shot glass worth, which is a full ounce. And that's really the correct amount. The other important tip is that you have to reapply, especially if you're active, if you're a swimmer, if you play beach volleyball. You're going to be sweating this stuff through your pores, wiping it off with your hands and other objects, and it's really important to maintain that coverage and reapply every 2 hours.
Is there a certain type that you prefer, this spray-on, the creams, and what about SPF, the sun protection factor?
Yeah.
How high should we be going?
They all work great, and I tell my patients to sort of just pick one based on their skin type. Oilier skin types usually benefit from oil-free products. People with normal skin types can use basically any type of product. SPF is important in the sense that it measures the amount of time it takes for your skin to burn. If you have SPF 30 on, it takes 30 times as long for your skin to burn. That said, the higher the amount of SPF doesn't necessarily mean you're going to be covered better if you don't reapply the sunscreen. So choose a sunscreen for daily use of around 15 to 30 because it's usually less pasty, less white, and it's tolerable for normal skin. On a day where you're going to be out for a while, choose a water-resistant type and try to go high on the SPF, and always remember to apply and reapply every couple hours.
As well as protecting from burn and so forth, there are things that we can do internally, right?
Absolutely.
To have better looking skin.
Sure. The most important foods you can pick are foods that contain antioxidants, specifically vitamins A, C, and E, which have been consistently shown to help protect the skin from the ravages of sun and also from aging. Vitamin A is found in a number of foods, including spinach, kale, red and orange colored fruits like mangoes, apricots, sweet potatoes, cantaloupe. Vitamin C is found in citrus fruits and vegetables, and vitamin E is found in nuts.
And what about if we already have the damage, and I know there are a lot of corrective measures, you have some tips on Botox, because applying it, I guess, or using it the wrong way
Right.
can have bad results.
Correct. Well, you know, the emergence of medi-spas and all sorts of non-trained injectors have led to a lot of adverse events with the use of Botox. What I tell my patients is always look for somebody who's board certified in dermatology or plastic surgery. Look for a doctor who's trained specifically to do this. Otherwise, you're going to get that freakishly frozen look. You're going to potentially have eyelid drooping and other bad effects from Botox. The point with Botox is always to try to maintain a rested, youthful appearance while still maintaining expression. The frozen face look is not in, and it never will be.
All right, Dr. Nakhla, thank you so
much.
For more details on Dr. Nakhla and how to take care of your skin, go to our website, KCAL9.com, click Seen on TV. He's also got a new book coming out. If you want to check that out, we've got the information on the website.